Hello, this is Debu Tripathi, Editor-in-Chief of Cure magazine. I'm here in San Antonio on the final full day of the Breast Cancer Symposium, and over the course of the last few days, there hasn't been a clear, immediate change that is going to affect patient treatment, but there are a lot of things that we are on the verge of finding out, and many of the trials that are near completion probably will affect treatment. Some of these were discussed today, so it's a preview of the future of what's to come. One area that we have tried to make advances in is in the people that have early stage breast cancer, and obviously we're trying to maximize the cure rate. We use surgery, obviously, chemotherapy, hormonal therapy, Herceptin in the case of HER2 positive cancers, but some patients present with very aggressive cancers, larger cancers with many axillary lymph nodes, and we know that even with standard chemotherapy and hormonal therapy that the risk of recurrence is still high. These kinds of patients can sometimes be identified by the ones who, when they get chemotherapy before surgery, still have a lot of tumor behind when they finally do go to surgery. There have been a couple of studies that have taken these individuals and tried to use additional treatments. One of the treatments that has been used for triple negative cancers, that is, cancers that don't make the hormone receptor or the HER2 receptor, is a chemotherapy drug called platinum. Platinum is a drug that's used in other types of cancers, for example in lung cancer or bladder cancer. It's not used much in breast cancer, but over the years we've learned that these triple negative cancers do seem to respond to platinum. And so the question of adding that on to standard chemotherapy has come up, and in this group of patients, 2 studies now have looked at the addition of platinum. One done by the German group that was presented at ASCO, and then another one done by a group called the CALGB that looked at standard chemotherapy either with or without platinum. And this trial also used Avastin, a anti-blood vessel forming drug, which has been disapproved by the FDA after being approved. It's not clear how much that contributes, but the real question was, does platinum add to the amount of shrinkage that patients get in their tumors? And the answer is yes, it does, from both the German study and the American study. Fewer patients had any residual tumor left at the time of surgery when platinum was added compared to the other group that got the same chemotherapy without platinum. So what does that mean? Well, it doesn't mean that we should go out and be using it at this time, because we have to wait and see if the number of recurrences are less. We know that what's called a complete pathologic response predicts for the fact that we expect to see fewer recurrences, but we're not quite ready to adopt this. That's one of the changes that we feel is going to be ready for application soon. The other drug that was reported today in a study called the I-SPY2 study is a drug called veliparib. This is a drug known as a PARP inhibitor. These are experimental drugs that inhibit DNA repair, and they seem to be particularly active in patients that have breast cancers that are associated with a BRCA1 or 2 mutation. And then there may be a broader group of individuals that have triple negative breast cancers that may respond to this drug. This drug, veliparib, was also tested in a randomized trial in patients getting neoadjuvant chemotherapy, and also showed that when the drug veliparib combined with carboplatin, a platinum-type drug, was used, that again, the number of patients that had complete pathologic responses was higher. So the PARP inhibitors represent another promising drug that are not quite ready for prime time yet, but will be further tested, especially in patients with BRCA1 and 2 mutations. So these are things that we have to look forward to in the coming months. These studies will soon be completed, and we hope that they get into the clinic as quickly as possible, and most of all that they are successful and actually help the cure rate of patients with early stage breast cancer.